Hello, thank you so much for inviting me to be on the panel again. My name's Ashley McDonald and I work as a GP, that's a family doctor in Newcastle upon Tyne, and I'm here to answer any questions about looking after your mental or your physical health in these really strange times. Hello, it's Ashley. As you know, I work as a GP, and some of you wanted to know a little bit more about how you become a GP. So what you have to do is, after you've finished primary school and then you go to high school, you can go to university and you can study a subject called medicine. And you usually study that for 5 years, and that's when you learn how to become a doctor. Once you've finished that, you have to work as a doctor for 2 years, just doing lots of different jobs, usually lasting about 4 months. So I did a job on a surgery ward, looking after old people in the hospital, and I also did a GP job, and that's when I decided that was my favourite thing, that's what I wanted to specialise in. So I did my 5 years at university, then 2 years as a junior doctor, then I decided I wanted to be a GP, and training to be a GP takes 3 years, and here I am now, I'm a GP. And I'm really happy with what I do. My favourite thing is meeting people and looking after families. So I see pregnant ladies, I see them through their pregnancy, I meet their babies when their babies are born, I see their babies as they grow up into children, and hopefully if I'm around long enough, I'll see those children growing up, and I know their grandparents and I know their parents, and it's a really lovely job. And definitely if you're someone who's really interested in science and likes learning things and likes meeting people, it's a great job to think about. The GP practice I work in is quite small, but when I say small, we have 8,000 patients, but obviously all of those 8,000 patients don't come to the GP every day. So usually, most of the time I speak to patients on the phone now because of coronavirus. So usually I would speak to about 15 patients in the morning and maybe see maybe 4 or 5 of them in real life, and then I would do the same in the afternoon. So I'm definitely not seeing 8,000 patients a day, but that's how many patients we have on our books that can ring us up if they need some help.
Ask the experts. Ask the experts.
If we cough, do we know if we have COVID-19? And how do we know if we have COVID-19?
If I got COVID-19, how will I get rid of it?
If I tested positive for corona, will I get it again? If everyone gets coronavirus, why are old people vulnerable?
How did coronavirus start? When will you think it will stop? What makes COVID-19 so bad?
How can we stop COVID-19?
When can we get a medicine for COVID-19?
Do diseases and illnesses always have a cure?
Will there be a second wave?
What are the symptoms of COVID-19?
Ask the experts.
Lots of you have sent in some questions about coronavirus, so I'm going to do my best to answer these questions. Some you might hear people say coronavirus, you might hear people say COVID-19. Coronavirus is the virus, that's the little germ that causes the disease, and the disease is called COVID or COVID-19. So I might use those terms at different times, but I'm probably meaning the same thing. The symptoms of COVID-19 can be anything really. In most people, especially in children, you might not even know you have it. It might have no symptoms at all, and it might not make you sick. In some people, they get a cough, they can get short of breath, they can get a fever, that's feeling hot and shivery, like you might do with the flu, which is another type of virus. Some people lose their sense of smell and their sense of taste, and that is a very specific symptom for COVID. Not many other things do that really. Some other symptoms that you might have heard people complaining of with COVID-19 are tummy upsets. So you can be sick and you can have some diarrhea, and you can feel very tired, very achy. So there's a wide range of symptoms, even runny noses and things like that can be caused by COVID-19. So what the government have done is they've picked the three main symptoms. That's the cough, the fever and the loss of smell or taste, and they've said those are the main symptoms that most people get with COVID-19, and if you get any one of those symptoms, you should stay inside your house, and so should everybody else in your household. So all the people that you live with should stay inside their households, stay inside their homes, and the person with symptoms should get a test as soon as possible, and that is really important to remember. So cough, fever, loss of smell or taste, any one of those symptoms, so even if you just have a new cough, you should stay inside, and you should tell your family to do the same and organise a test as soon as possible. Obviously, one of the other questions was, if we cough, does that mean that we have COVID-19? No, it definitely doesn't. There's lots of reasons why you might cough. Lots of different viruses cause a cough. It doesn't mean that you have COVID-19. Somebody asked, what is it that makes coronavirus so bad? Well, the main reason, I think, is because it's brand new. Humans have never seen this type of coronavirus before. We think it jumped species from bats into humans, so our immune system's the part of our body that usually fight off bacteria and viruses and nasty bugs. It doesn't know what to do with this. It's never seen it before. The second reason why coronavirus is so bad is that, people who have it don't necessarily get symptoms. Most of you, being young people, probably won't even know that you've got it if you have coronavirus. But even with no symptoms, people are still able to spread coronavirus to more vulnerable members of society who might get sick. And I suppose that's the third reason why coronavirus is so bad, because in some more vulnerable members of our society, so particularly in older people, people in their 70s and 80s or even older, some people who are obese or overweight, and people with underlying health conditions like diabetes or lung disease or heart disease. People in these sort of groups, they can get very sick, and some of you might even know friends or relatives who have been very sick with COVID-19 or maybe even have died from it. So that's really what makes COVID so bad. Although I have to emphasise that, the risk to children and young people is really very small, and particularly in younger children, they don't really seem to be spreading it much either. There were also some lovely questions about how can we get rid of coronavirus, when will it end, and is there a medicine? So the first answer about when will it end is, I don't know. I wish I did. Nobody really knows. The main thing people think, especially scientists think, that will put a stop to this is when we get a vaccine. That's an injection that tells your immune system how to fight the coronavirus. So until we have that, it's going to be very difficult to get rid of it, and we might never get rid of coronavirus completely. But the good news is that the doctors and scientists are coming up with better treatments all the time, and they're doing some really important research, some of it in the UK, on developing a vaccine. And hopefully in the next few years we will all get the chance to be vaccinated, and we might be able to get back to living our lives in a bit more of a normal way. People who are getting very sick are already benefiting from new treatments such as steroid treatments and certain types of antibody treatments, and the doctors in intensive care know more about ventilating patients, so putting them on breathing machines and oxygen, and so the survival rates are already going up. So there's some good news, but we're certainly not at the point where we're at the point of a treatment or a vaccine to cure it yet. So the most important thing at the minute is to keep social distancing, so keep the numbers down, stop coronavirus from spreading by limiting your contacts with other people from face to face. If anybody in your house gets symptoms, so the cough, the fever or the loss of smell or taste, stay inside, get your test done, get your household to stay inside, and hopefully with these two really good measures and the test and trace system that's hopefully going to start working better over the next few months, we'll manage to get the numbers right down so that society is a safer place to start going out again and socialising and doing the things that we used to not even think about doing and we used to enjoy doing.
Ask the expert.
Do face masks actually protect you? Is it okay if you do not wear one sometimes?
Why do kids in primary school do not have to wear masks? If we are in a bubble, doesn't it still spread?
Why do we wash our hands for 20 seconds? What happens if we don't wash our hands?
Do you have to eat healthily and have vitamins not to get sick?
Ask the experts.
Some of your questions were about protecting yourself and other people from getting coronavirus in the first place. And one of the main ways we do that is wearing a face covering or a mask over your nose and over your mouth. And the way that that works is by you wearing your mask, you're protecting me and other people. And when I wear my mask, I'm protecting you. If you imagine on a cold day, when you breathe out, you can see a sort of water vapour coming out, and the same when I speak, when I sing, when I'm shouting, little sort of water particles come out of my mouth, and we think that virus can live on those. And when I'm talking and somebody else can breathe in, if I was infected with coronavirus, I could transmit it to them that way. By wearing a mask, that puts a barrier in the way. So when I'm talking to you, my mask stops those particles from coming out and then you don't breathe them in. Your face covering will protect you a little bit, but really the only way to protect yourself fully with a mask would be to wear one of the big sort of surgical masks that you see them wearing in intensive care, and those are really just reserved for hospitals. So if everyone who can wear a mask, we can limit the spread that way. Now I know there'll be some of you and some of your grown-ups that can't wear masks for different reasons, sometimes health conditions and sometimes anxiety. Some of you might have autism spectrum disorder. That means that you don't like things being on your face. That's okay. We need to do what we can to keep each other safe. But if you're not able to wear one, or if you see someone who isn't able to wear one, then that's okay. They have their own reasons why they can't wear them, and we just need to do the best for ourselves and other people that we can. The other way that we can protect ourselves and other people is by washing our hands, and we're told to do that for 20 seconds with soap and water, and that is because we think this virus can also be spread by touching things. So for example, if I cough into my hand and then I touch my computer, or if I touch the door handle and then somebody else was to touch those things, they might pick up my germs, my viruses. So frequent hand washing for 20 minutes just washes that virus away, and coronavirus isn't that brilliant, it's not that clever, it's actually very vulnerable to soap, so it can be killed by soap. How easy is that? So by more hand washing, that keeps the virus to a minimum. Other things you can do is you can cough into your elbow rather than your hands if you don't have a tissue handy, and you can keep a good social distance between yourself and other people, so 2 meters or 1 meter with a mask, if you're unable to get that 2 meter distance.